Hello everyone, my name is Dr. Vijay Bhatia and today I'm going to talk about insomnia. What is insomnia? Insomnia is a condition of unsatisfactory quantity or quality of sleep, which persists for a considerable period of time, including difficulty in falling asleep, difficulty staying asleep, or early final wakening. Insomnia is a common symptom of many mental and physical disorders. So it is very much subjective feeling, and this depends on a number of individuals differently. Each person may complain differently, and some people don't complain about quantity, others complain of quality, some people complain of quantity, others complain of quality. Quantity is different for each individual, but normally we say 7 to 8 hours of good night's sleep, good quality sleep is sufficient for most of us, apart from babies. And even with this quantity, it depends. If you've been enjoying a late evening and then you want to be awake in the morning and get up and get ready, and that's fine. But if it persists for a considerable period of time, then it becomes a disorder, and it is included in ICD-10 for mental disorders, insomnia of non-organic origin. And some people complain in difficulty staying asleep. They keep on waking up few times, and other people complain early final wakening, which can be problematic when they wake up in the morning, they don't feel refreshed, they still feel tired, lethargic, not enough energy, and not able to function the way they want to. Their attention and concentration will be poor. They will not be performing the work they want to, and they can't. It causes like a personal distress to them. And because it is a common symptom in many mental and physical disorders, like any mood disorder or any um, anxiety disorders, it plays a number of uh, roles in a number of different mental health problems. And similarly, physical disorders like sleep apnea can be a contributory factor, or it can happen in those people. Or there are other physical disorders, people suffering from back pain, asthma, or they are suffering from pain in general, which is affecting them, stopping them going to sleep. Whatever the cause, insomnia will cause distress, will cause difficulty in when they wake up. They still want to feel as if they did not have a good quality of sleep, and they still feel tired. What is the criteria for insomnia? Well, there are 4 criteria. Number 1A, the individual complains of difficulty falling asleep or difficulty maintaining sleep and non-refreshing sleep. So the person will complain themselves, I am not having, uh, I cannot go to sleep. I keep on, uh, even if I lie down on my bed, I keep on awake for hours and hours. My mind is not resting. I keep on thinking, or mind is completely blank, but I can't go to sleep. Or they keep on worrying about something next day, and it happens day after day. Or some people say they can't maintain their sleep, they keep on waking up every 2-3 hours, and or even earlier, and once they wake up they can't go back to sleep, and sometimes it takes hours, and then they start getting doing other things and other things, which contributes even more to fall asleep. And ultimately when they wake up they are not fresh, they still feel weak, tired, lethargic, and lack of attention, concentration, and can't do any function. So that's where insomnia comes. That is the first criteria of insomnia, diagnosing insomnia. Number 2 is the sleep disturbance occur at least 3 times a week for at least 1 month. So if somebody is having a sleep disturbance for only few days and then they are fine, or if they are not sleeping very well for a few weeks and then they are fine, that's fine. But if it is happening at least 3 times a week and for at least 1 month, then that will fulfill the criteria of non-organic insomnia and will be considered as mental disorder, meaning that there can be some reasons to treat this, provided the other mental disorders are not present, especially the depression or mania or hypomania. If those are present, they should be treated first before you even think of helping with the sleep. C, or third criteria, the sleep disturbance causes personal distress. There is a marked personal distress, and this interferes with their personal functioning in daily living. Daily living functions can be even things like washing, dressing, maintaining their personal hygiene, and able to function and work either at home or at work. They will be making mistakes, they will feel tired quickly, they are falling asleep at work. So these things are causing personal distress to the person, and that will be the third criteria for the non-organic insomnia. Number 4, there is no causative organic factor such as neurological conditions or other medical conditions or even psychoactive substance use disorder or medication. They are taking some medications or stimulant medications. And the examples will include even excessive tea, excessive coffee, excessive coke, especially in the evening, use of cannabis regular, or even regular use of alcohol, which will make the person keep on waking up in the middle of the night to go to the toilet, and then they can't fall asleep, and then in the morning they feel tired and lethargic, not able to function. Even simple fizzy drinks, especially in the evening, can make things worse. There are certain medications like Ritalin prescribed for people with ADHD. They can cause insomnia. There are other number of other medications which can contribute to the same thing. Even some medical conditions like sleep apnea. Somebody is very obese, when they fall asleep, they are snoring, and therefore they can't get the quality of sleep. In this, they may get the less quantity or the quality of the sleep. Some people are working night shift, some people are traveling at night or from one country to the other all the time, most of the time. And what happens is ultimately their sleep-wake cycle is disturbed, and they get into this pattern where they're finding difficulty either in going to sleep or keep on waking up in the middle of night or keep on waking very early. Now these symptoms, if they are a factor for any mental disorder, they should be treated first. Like in this example, if you have going to sleep is the major problem, the person keeps on worrying, and that can be because of anxiety. In others, if they keep on waking up or thinking negative thing in the middle of night and fearing something bad is going to happen, and they feel worthless and useless and cannot get out of this rut, then they can be feature of depression. Early morning is a feature of severe depression. So these should be treated first to help the normality of the sleep. Thanks for watching. Please subscribe the channel and press the like button if you like the video, and share with your other colleagues.